IBD updates, wow, that's a big subject area. I had a hard time deciding what to talk about, and I think I'm going to try to focus really on what might be, a change from dogma a little bit and what surgeons should be thinking about. I have no disclosures. So we'll just start off with a Mayo Clinic quote because IBD is so complex. The treatment has to help the patient and present low risks. And of course, we always hope for personalized medicine and personalized care. And in IBD particular, it requires a team approach. You have to engage your gastroenterologist and the surgeons. And we're going to focus in Crohn's disease really on limited ileal disease because I think there's some new data out that would suggest maybe a surgeon has a bigger approach. And then perianal Crohn's disease, specifically fistulizing disease. So again, where we've always been told, don't do anything surgically. Don't touch them. Let them treat with medicines. There might be some new data to suggest something quite different. And then ulcerative colitis, really the risk of surgery. And then what are you going to see in the field out in the community? And some things for you to consider, especially since we get a lot of these pouch patients post-colectomy. Now what am I going to have to deal with when I try to make their pouch? And then the long-term outcomes that you can help describe and educate your patients that you see. So of course, we all hope for personalized medicine, and there's no question that there are a lot of different medical treatments now available for patients with IBD, because the alternative is a curse. And over the last 30 years, there have been a lot of changes, but the truth is that the oldies are still the goodies, and anti-TNF over the last 30 years is still the best treatment. And about a third of patients will have maintenance of healing in the long term. Now from the surgical side, we've gone from open techniques to various forms of minimally invasive techniques, again, all improving care for the surgical patient. And in addition to surgery, you now have a better postoperative follow-up, and enhanced recoveries such as ARIS have certainly improved the risk profile of patients that we treat. Now, because we have all of these medications, has this changed the natural history of the disease? I think we heard from, I believe it was Nitin, it may have been Luca, that the number of acute